The rules for measuring blood pressure are designed to ensure accurate and consistent readings, which are crucial for diagnosing and managing hypertension and other cardiovascular conditions. Here are the key rules and their significance. Resting state. Patients should rest for at least 5 minutes before measurement to avoid elevated readings due to physical activity or stress. Seated position. The patient should sit with their back supported, feet flat on the floor, and arm at heart level to ensure the reading reflects true arterial pressure. Correct cuff size. Using a cuff that fits the patient's arm correctly prevents inaccurate readings. A too small cuff can give falsely high readings, while a too large cuff can give falsely low readings. No talking. Talking can increase blood pressure temporarily, so patients should remain silent during the measurement. Multiple readings. Taking at least 2 readings a few minutes apart and averaging them provides a more accurate assessment. Avoiding certain substances. Caffeine, tobacco, and certain medications should be avoided before measurement, as they can temporarily raise blood pressure. These rules exist to eliminate variables that can distort blood pressure readings, ensuring reliable data for clinical decisions and effective hypertension management.